Good day everyone, I'm Melody Bukobo, student nurse from Nasogastric University of Science and Technology, BSN-TC. And for today's video, we're going to do a nasogastric tube insertion. For the assessment, check the doctor's order, client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials, check for history of nasal surgery and deviated septum, assess patency of nares, determine presence of gag reflex, assess mental status or ability to participate in the procedures. For the planning, before inserting a nasogastric tube, determine the size of the tube to be inserted and whether the tube is to be attached to suction. Next, we need to prepare equipment. First, we need a large or small-bore tube, non-latex preferred, non-allergenic adhesive tape, 2.5 cm wide, thin gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw, 20 to 50 ml syringe with an adapter, basin, pH test strip or meter, bilirubin dim stick, stethoscope, disposable pad or towel, clamp or plug, optional, anti-reflux valves for air vent if saline sump tube is used, suction apparatus, safety pin and elastic band, and CO2 detector optional. And for the implementation, first we need to introduce ourselves and verify the client's identity using agency protocols and explain to the client what we're going to do. Good day, ma'am. I'm Melody Bukobo, your nurse for today. Can I ask your name and birthday, ma'am? Okay. Can I see your wristband for verification? Okay, thank you. So, for today's procedure, ma'am, I'm going to do a nasogastric tube insertion for you to order to promote adequate nutrition while having an underlying condition. Is that okay with you, ma'am? Okay. And then next, assist the client to high Fowler's position if her health conditions permits, and support the head on a pillow. Then place a towel or disposable pad across the chest. And then next, perform hand hygiene and observe appropriate infection control procedures. And then after hand washing, perform gloving. After gloving, we need to provide for the client's privacy. Next, assess the client's nares. Check for the patency to see which one is patent. So, we're gonna assess the nares of the patient. And prepare for the tube. Support the patient during the procedure. Then determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the sipod process. So let's start from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the sipod process. And then, after that, mark this length with adhesive tape if the tube does not have markings. So, tape it. Next, after marking, insert the tube. Lubricate the tip of the tube wall with a water-soluble lubricant or water to ease insertion. You can ask somebody to help you when it comes to lubrication. So let's start to lubricate the tip of the tube. And then after lubrication, insert the tube, which is natural curve, toward the client into the selected nostril. Then ask the client to hyperextend the neck and gently advise the tube toward the nasopharynx. So, ma'am, can you hyperextend your neck? Okay, thank you. And then insert the tube up to the marking you just made. So this is my marking. And if the client's gag stops passing the tube momentarily, have the clients rest and take a few breaths and then take sip of water to calm the gag reflex. So, ma'am, we need to take a rest a little bit and take a few breaths. And have some sip of water. And then ascertain correct placement of the tube.
Aspirate the stomach contents and check the pH, which should be acidic, confirmed by X-ray. Place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube by listening for whoosing sound.
You can hear a whoosing sound. If yes, then you inserted the tube in the stomach and not into the lungs. Next, secure the tube by taping it to the bridge of the client's nose. You can use 1-inch micropore and cut into the half that will be used as an anchor of the NGT. For the evaluation, evaluate the patient's response to the procedure and then document the procedure and other important data on the client's chart.